One noteworthy encounter I had while working as a nurse was caring for a patient who was quite anxious. I never treated a patient with this much anxiety before. And in the end, I sat down and discussed with her the causes of her anxiousness. She received some tools and knowledge from me on how to deal with anxiety. This contact was vital to me because it made me realize how important it is to pay attention to my patients and take the time to understand them. It also taught me that sometimes all my patients, all they want from me is for me to just listen to them and to be there for them. I'll never forget this patient and how much of an influence she had on the rest of my nursing career. My grasp of psychopathology and the patient-provider connection was greatly enhanced by this patient engagement. This engagement taught me the value of listening carefully and spending time getting to know my patients. It also taught me that sometimes all my patients want from me is for me to listen to them and to be there for them. I became aware of the value of the doctor-patient connection and how much it may affect a patient's mental health as a result of this patient contact. This discussion also reinforced the value of understanding various pathologies so that I may better understand and support my patients. The provider-patient connection, pathology, and the function of the psychiatric mental health nurse practitioner were all significantly impacted by this patient encounter. My ability to connect with my patients is one of my greatest assets. I have a gift for talking, and I try to get to know every one of my patients on a personal basis. This is, in my opinion, crucial because it fosters a relationship of mutual respect, trust between the patient and the practitioner. The effectiveness of the patient-provider relationship depends on this rapport, which may also have an influence on the patient's mental health. One of my personal weaknesses is that when meeting new people, I may be a little judgmental due to my lack of openness and engagement with new patients. They may have an effect on the provider-patient relationship. To better connect with new patients, I may need to work on this constraint. My capacity to relate to my patients on a personal level is a skill that I really want to foster and continue to grow. It is crucial for me to demonstrate to the patients that I am sensitive to their needs and that I am aware of what they are going through. Overall, I believe that the patient-provider interaction is both positively and negatively impacted by my own strengths and weaknesses.